I might have 12 months of depression and then the rest of it would just be high, manic and out of control, and I just have to control that. I was really prepared for my life to go that way, and actually having had the Save Minds ketamine treatment, it's flipped my life on its head. And as a personal thing, Yadu, you're super busy, and at the moment I am too as well, but we, on a personal level, we haven't actually spoken about what's changed in my life, and it's dramatic in a very good way. So, I mean, we can talk about that another time. I think this is important to sort of introduce Save Minds. There's something that I'm interested in, and I actually know the answer to it because we've spoken about it as part of, not as part of one of the treatments, but just as we spoke. But what was your reasoning for starting Save Minds?
So, Sam, I am a consultant and I work in intensive care where we support every organ possible, right? When somebody's very unwell, right? Whether it's kidney, liver, heart, right? I am very well used to managing them. And mind has always been, for a long period of time, an issue which I have always looked at to see, the mind is one thing, it's one of the most complicated piece of organ in the entire cosmos.
Can I ask you a question there, Yadu? Do you separate the brain from the mind?
I think so, right? I think so, 100%, right? And for me, it started way 30, 35 years ago. I lost one of my very, very close friends, right, from mental health illness. He died, he committed suicide, right? I thought I'll be ever a friend with him for a long period of time, but I lost that. I've seen family members suffering, I have seen friends suffering. So this has been always a thing which was in my mind, but in my training, anesthetics, intensive care, I was going in a different route. But when I became aware that an anesthetic agent, which I am very well used to over the last, however, when I started anesthesia 25 years ago, I've been using ketamine, right? Ketamine in small doses can treat people with mental health illness. I thought, this is what I need to look at. Right? And it took about 3.5 years of work, research, speaking to various people, attending meetings to know about it, because a drug as ketamine, I know about it, right? But not its effect on mental health, because that is something very new to me, right? So I have to do all these things, and then there were people, psychiatrists who helped me, right? And then that is how the Save Minds was born, with a passion, not about profit, but with a passion to treat people with mental health illness, right? And if I can change somebody's life and mind within 3 to 4 weeks, right? Initially, I thought to myself that is something which is a bit of an exaggeration, but we have treated more than 100 patients now, given about 1,000 infusions. And when I see the response, it is honestly an eye-opener to me.
Massively.
Right? I never expected.
Someone on the receiving end of that, Yadu, as I say, like, I know you're a very busy, important man, and I'd like to speak to you all day. And afterwards, hopefully, we can have a little bit of time just to sort of, so I can just say the personal things about what it's done. But it literally has. I mean, because I worked out, Yadu, I hadn't had a clear state of mind since I was about 16, 17, 18, and now I'm 31, right? You can't comprehend that. If someone is listening to this that can comprehend not being, in quotation marks, normal for 14 years and then suddenly having this, unbelievably powerful experience that essentially just takes away that pain and suffering of 14 years, please get in contact. Because I promise you, I can't... I think I'm quite good with words, Yadu, but I can't put that into words what that feels like. Because for one, it changes every day. And for two, there's so much that it's done. It's honestly, Yadu, it's very, very difficult to just articulate into a concise sentence. It really is. And that's the point. It's phenomenal. Phenomenal is not a strong enough word.
It is, isn't it something from, not as a doctor, but as a human being, to see that relief, right, that enjoyment back in life, right? This is what actually makes me happy when I do this. As I said, I have done intensive care. We have saved so many lives, right? Lost so many lives, right? But that is a mind-changing experience for anybody who's unwell, right? But now, in the last 2 years and 3 years, to be honest, the satisfaction I get from treating people and seeing that relief is as good or even more than what I have done for the last 20 years.
But it is like, that's the thing, Yadu. Like, you can't take anything away from that, because you are literally saving lives. Because mental health, and look, we've already mentioned suicide, so I'm going to have to, have a trigger warning, which is absolutely fine. But the most severe symptom of mental health disorders or problems or anything, however you want to phrase it, the most severe symptom is suicide, right? You've already experienced that in your life, and I think it's sadly touched a lot of people in their life, whether it's someone knows or someone knows that knows, whatever, right? But that's the point. Like, if you're stopping people from having mental health disorders, then you are stopping suicide, right? So you are actually saving lives, 100%.
Yeah, and the thing is, this is what I'm still in the process of learning, right, and experiencing this, because it's something new to me, right? I am not an expert. I'm a student learning this. In people with suicidal ideation, right, when they come and receive ketamine treatment, within about 2 to 3 treatments, the idea that thought, right, that intensity of the thought and that seeking to act on that thought almost goes away, right? In 2 to 3 infusions, to that extent, about 20 to 30% of our people who come through our doors, right, have actually attempted or at the verge of attempting, right? And
can you say that again? Sorry, Eddie. What was that last bit? They've either attempted or...
of the people who come to us for treatment,
yeah,
right, have actually either attempted suicide or on the verge of attempting suicide.
Yes.
And the family becomes aware, and they are worried, and they bring them for treatment. And within about 2, 3, 4 treatment, when I speak to them, they say the thoughts are there, but the intensity and the ferocity of it comes to them is very much reduced, right? And they're not bothered about it.
Oh, 100%.
Right.
Yeah, 100%.
Right.
And I think, look, I don't know if you had an opportunity to, I'm sure you haven't, but one of the episodes on the podcast is writings of a suicidal thinker. So I wrote a lot of stuff down. I think, you know what I was like in the treatment. I always had things that were written down and stuff like that. But I wrote a lot of poetry, essentially, and I've done a sort of sub-series on the podcast, which is essentially the writings of how I felt when I was suicidal. And 100% I was when I came in. And I think it was actually one of the most difficult experiences of my life at Save Minds. And it wasn't anyone's fault, it was just something that happened. Was that there was question, because my sister was in when we did the first consultation or whatever it was before I did the first treatment, and one of the questions you asked me was, have you ever had suicidal ideation? And my answer with that, to be honest to you, was yes, because I had, but my sister never actually knew that. So she knew that I was severely depressed, and she knew that I was very unhappy, and some of the language and some of the conversations that I had with her would suggest that I probably was, okay? But I'd never actually said, I've had suicidal thoughts or I've had suicidal ideation. And so to actually have said that in front of her was one of the most difficult but also empowering things, because it was very much, for me, a situation that sort of went, I don't want my sister to know that I've thought about suicide, but I need to tell this man who's going to treat me. So in a way, as much as it felt bad at the time, on reflection, it's like, that was powerful, because now I have to, in this podcast, I have to be able to talk about suicide on the basis that it's a symptom of depression. Suicidal thoughts are a symptom of depression, and unfortunately, that's something that needs to be addressed a lot better than it is at the moment, I think.
Yeah, I think, it comes with, again, Sam, I'm just a student more than anything else in what is happening, right? The psychedelics is often told as the telescope for the astronomers and the microscope for the biologists, because this is the future of mental health illness, right? And
do you believe
people,
that, Yadu? Do you think that's actually? Do you think we're in the process of that now?
I think so. I think so. More and more people understand the mechanism, right? There are a lot of work in Imperial. There's a lot of work in John Hopkins. A lot of universities are actually studying the MRIs, right? MRI, functional MRI scans with psychedelics and, where it works. Like, there's a default mode network. There is a medial prefrontal cortex. There are areas of the brain which has this power of, bringing all these feeling of who you are, the thoughts, and reinforcing those thoughts, right? And the psychedelics, what they do is to separate that, right? By separating, now people often tell the people who are suffering from mental health illness is that, you need to stop thinking about all those things. You need to stop, don't think about it. You can't do that. The mind will never allow that to happen because it keeps on recurring, right? So the only way, as far as we know, or at least I understand, is that, during the psychedelics experience at the time, is to bring new positive thoughts into the treatment, right? And that is exactly what you were doing, Sam, right? You had a theme, you brought in, during the treatment, you were thinking about it, actually bringing in new thoughts to override the thoughts of, hopelessness. Why am I here? I'd rather be not here, right? So by bringing them, and the psychedelics facilitate that. No other medication facilitate that. Psychedelics facilitate that, right? And by doing that, you bring in new thoughts, and as a result, the old thoughts about yourself starts going away, right?
And that's interesting, Yadu. Sorry to interrupt, but that's interesting. Again, I haven't mentioned his name, so essentially he's just a private psychiatrist, right? And as far as we're concerned, obviously, I know you've been saying my name's Sam, but as far as the listeners are concerned, I'm just Bipey Fox, so they don't actually know who I am. But so there's no link to this person, but actually my psychiatrist said exactly the same thing. He was saying to bring your thoughts, your positive thoughts, or your positive affirmations into the treatment, and that was part of it, because as you may or may not remember, I wasn't keen on actually having the involvement of the psychiatrist, because I thought, well, look, he's passed me over to you, Yadu, so why don't I just deal with you? But actually having a two-pronged attack, I think that's important as well, knowing with the treatment, that actually having your psychiatrist who knows essentially, he essentially knows your brains and your brain, your thought insight, and your thoughts and your mind and everything inside out, because he's studying you essentially as his job. I think that's really good to have like a two-pronged attack when you're doing the treatment. And actually, as you said before, like it's an expensive treatment, but it was worth every penny to have the psychiatrist on board as well, because if for anything else, it just reiterated the idea that actually, it's two very, very established professionals, two opinions, no more, just two. But the one who knows you really well, the one who doesn't really know you but knows his product, that's you. And then together, yes, it's expensive, but for the sake of how much it costs to essentially save my life, I think that's worth it in anyone's life, right?
It is true, Sam. And, I hope one day, in the very near future, this will be available not for people who can afford, but should be available through NHS for everybody.
Yeah.
Right? Because if, in terms of the cost of the mental health illness, it's huge to the economy, right? And, people like you, right? It is in young people. It starts sometimes in teens, right? Goes right throughout. And we have had people who are in the other extreme of age. We have had young people at the other extreme of age, and they come, and all their life they have been dealing with this issue. Right, and when they are treated and when it is successful, they tell me that it's actually reborn. Right, this is I am maybe 70, but I have reborn again.
Oh yeah,
because it's a time. So this actually touches you, right? Very hard to say that why this is not available, but there is a lot of progress being made in terms of research, in terms of various different medications like ketamine, the psilocybin, DMT. All these things are happening. It's happening in Imperial, it's happening world over, right? And that will be the future. But the issue is that how quickly and how carefully and safely we could get this available, not to the people who can afford. Fortunately, you